So now let's move treatment. One more thing I'll tell you. I don't work for the company Game Ready, but I can tell you that it's a fabulous. I don't know, does anyone here have a Game Ready? Excellent. Okay. I'm a skeptic with the IRAP, the Shockwave. I've always been a skeptic. So this Game Ready was at the Olympic trials in Southern California, and Bob McDonald said, "Hey, I've got this great new thing. You got to come see it." And I said, "Okay." I mean, it was Bob, so you got to trust him, right? Because they had it for Brentina. And he showed me this cool red unit, and I said, "Okay," but he said, "No, let me put it on your arm." So you put it on your arm, and you're sold on this thing. What I can tell you now, and what it is it's cold compression. So this is the company's little schematic of you've got cold compression on there. And what I can tell you, and here's a couple of things that you might be treating here. That's that swelling around the fetlock that's called different things, but it's the tendon sheath, and there's a branch lesion and a suspensory. We've been incredibly, now it's not inexpensive, but we've been incredibly impressed with the results on soft tissue injuries. So again, in our practice, all the disciplines to some degree have embraced it. So we've got racehorse clients that have it, we've got show jumpers that have it, we've got Western Performance that have it, show Arabians, and dressage clients that have the Game Ready. Again, not inexpensive, but it's worth it because our horses are not inexpensive either. And if you think of all the therapies, what this does is you can either use it in injury, and in fact, the company will also, I think it's GameReady.com or something, but the company will also rent a machine to you if your horse has injured itself for a tendon or a suspensory. You can rent it for a period of 2 to 4 weeks or longer, or if you buy it, you treat the horse after you work the horse hard. It's a good thing. Okay, so I'm just going to finish up. I'm going to go 5 more minutes with this, and then I'll still have time for questions. I just want to talk about arthroscopy because when I give these talks, sometimes I walk away and people don't realize that a large part of my business is still surgery. So a lot of it is arthroscopy. And so I'm just going to show you a little bit about the new stuff in arthroscopy, and it's a cool way to end. But here's a horse's stifle that has a degenerative meniscus in there. And those are things that you don't see even with ultrasound or radiographs or bone scanning or anything. So I put it under diagnostic imaging because to some degree, and especially stifles, so I'm going to show stifle things right now. Sometimes a stifle we can't see what the problem is until you do that diagnosis. Now, I don't jump to arthroscopy. The horse has to block out. The horse has to not be responsive to treatment. We can't find other things, and then we might find a degenerative meniscal horn that needs to be debrided. We might find a soft soft cartilage over the top of the bone that's not doing well in the stifle. We might find score lines of wear lines of arthritis in certain joints. So let me just show you, as long as everything works here, I'm going to show you just a few videos, because the other neat thing, I was supposed to talk about new technologies and things. A good friend of mine is Joseph Berning. Dr. Berning is one of the top surgeons in Germany. So he does a lot of the horses you have purchased from Germany will have had their OCDs removed by Dr. Berning. There's 2 major orthopedic surgeons, Dr. Jan in Hamburg and Dr. Berning is kind of in the Hanover region. So those guys are phenomenal surgeons, great clinicians, and what he started on years ago, he's been trying to get me for 7 years to try CO2 in the joint. And so finally he got fed up with my, my sluggish response to his encouragement. So he sent me a unit 2 years ago, or 3 years ago now. And so what I'm going to show you, in fact, this is happens to be an Arabian show horse here that's very lame, right? Whoops. It'll come up here. Okay. So here he is, very lame in the right stifle, lots of swelling. And we tried a whole bunch of treatments before surgery that didn't work. But now we're putting CO2 in there. And so this are the joint surfaces with CO2, no fluid in there. So we put the scope right in there. There's the patella. This is the lateral femoral tibial. There's the meniscal ligament. There's the condyle here, the lateral condyle. And then come over to the medial. There's a beautiful view. Whoa, stop there. There's a beautiful view right there of the meniscus. There's the medial meniscus. There's the condyle. Okay? And then I'll just show you a couple of other ones. In fact, these are all recent. Here's a pretty neat one because I just did this one last week. This is a young racehorse prospect, but he had a radiographic change. This is the lateral trochlear groove where dressage horses get OCD a lot. So he had that change on the radiograph, but he had a fragment, and I couldn't figure out where the fragment was because it didn't look like it was there. So here's the patella up, there's the groove that it slides in, but here's the area where they commonly get OCD. And it's not normal, so I'm going to debride it here and take that abnormal cartilage off, but it's way over on the side, and so it's not going to affect this horse's performance, but I still couldn't figure out about this fragment. And so when I'm looking around the joint here, doing the rest of my exploratory after debriding that area, oops, there's a little, whoa, what's that doing there? Okay, so there's the fragment, and that's rare. It's loose, so that's a needle, and I'm just pushing the needle in saying, okay, that's just a loose fragment hanging around the stifle. That's not a good thing for any horse. In fact, they used to call it a joint mouse because it ran around the joint, but it's not very common. And there we are, just going in there, removing that little thing so that he won't have a problem. Again, doing that at a young age. A lot of the OCD stuff that you've talked about over the years we don't talk about it as much in dressage horses because the Dutch and the Germans radiograph all the horses as youngsters and they take the fragments out, and that's a good thing. I'm not saying that's a bad thing or they're covering anything up. It's a good thing. It's the same thing that I'm going to do next month with the race horses in Southern California is we go through all the yearlings and x-ray them looking for fragments because we'll fix them before they go become race horses. The Germans and the Dutch fix the horses before they come over. So I do warm blood surgery. It tends to be exploratory stifle and fragments in horses that have been bred in the United States. But other than that, I don't do as much arthroscopy in the warm bloods. And let me just see if there was a couple of others. This is good to look at because this is, you'll see the contrast here. This is an arthritic joint now. You can see that it's got the defect in the same area, but see how roughened the cartilage and the other joints were smooth and pristine. Look at all this issue here. There it's normal, but over here it's all abnormal on the patella and the groove as it was rubbing across there. So that's not a very good thing to find in a dressage horse. Here is the cystic lesions. Okay, so this is one just last week. Again, it's a young racehorse, but that's putting a needle into the cyst on the medial condyle of stifle. So now I don't debride those anymore. We put a needle in, and then we inject. So now you're going to see the steroid coming out. So we inject steroid into that lesion to try and help it to fill in with bone. So as soon as it gets seated in there, you'll see the injection, and it'll start pooling out there. That steroid is what we use to counteract those lesions. And that horse had a bad time of it. It's not too bad, but that horse also had a fragment in the fetlock, and there's an OCD in the horse's hock there that we removed. And again, this means nothing to the horse's future. We take care of it now, and the horse is going to be a fine athlete, whether it's a dressage horse or a racehorse.